Good evening, everybody.
How's everybody doing?
We have a fun evening tonight.
Yes.
We have a really good subject to discuss tonight. So this is going to be really interesting for you.
I think it's a fun subject. I think it's now, with the change up in the aesthetic field, more males coming into it. I think that it's very appropriate. I went to a MERS global conference last week. And yeah, two of the lectures, one was on female actually injecting down in that area, and then the other one was on males. And I think it was really interesting. I'm sure a lot of people are like, I don't want to get in that area. But for those of you guys that really want to jump into a growing need and field, there is. And we have two of the experts that will be on later on, joining us later. I personally don't do it, but they do it a lot. And so we'll get their take on it and how to approach it and even how to get into starting to do it, because I'm sure there are a bunch of people that are interested in joining that aspect of injecting those areas. So but
the Netherlands.
the Netherlands.
We're talking about the Netherlands tonight. This will be super interesting. It's like something that I don't do myself either, but my fear is I don't want to injure something there. I don't want to break it. So I'm like, I'll let somebody who knows what they're doing do it. Like, they can go to Jessie or TJ because I want somebody who really knows what they're doing. And the more you do something, the better you are at it. Yeah. And the more that you know the subtle nuances of outcomes. And I respect that very much in people who do something that I don't do.
Yeah. And then today we are going to jump into our amazing topic, the rise in male aesthetics, the growing rise in male aesthetics. We have two experts with us. We have Dr. Jessie Cheung. She's a dermatologist out of Chicago, and she's been playing around in this field for a while. Hi, Jessie.
Hi. So happy to be here.
And then we have Dr. TJ Tsay, very close to us down in Tustin. He's out of the ER world, but loves aesthetics, so we pulled him into aesthetics. And so he's the cowboy. Like, if you think I'm the cowboy, he's the cowboy.
He's the cowboy on speed.
So thanks, TJ, for coming. All right, guys. So this is a unusual topic. I think it's for a lot of people uncomfortable. I know I was with Jessie at Mexis in Niagara Falls a week ago, and I think half the audience, a lot of the guys were like, ooh, they were. Yeah. It's just one of those topics. But between you, Jessie, and TJ, like, what are you seeing with regards to working in the male genitalia, the female genitalia area? What are you guys seeing over? And can you tell us the trends that you guys are seeing over the last 5 years?
Yeah, like what are some of the concerns that people are coming in with that you can treat?
Jessie, ladies first.
Okay, Jessie.
Okay. Well, we're gonna call it down under, right? Australia, not the Netherlands.
Down under, I love it.
And with my men and women, we talk about appearance and functionality, because there's sexual function that we could treat with the injectables and lasers that we have, and then there's appearance, whether it be size, girth for men, length, wrinkles down there, and for labia, we can make them plumper, we can shrink them, we can make them smoother. The anus is a sexual organ too that we either loosen or tighten or smooth out. So form versus function or an appearance.
Okay. TJ, like, what are you seeing as far as the trends actually with regards to the genitalia area? Because it's always a faux pas. I mean, we as Americans are very prudish. I'm sure the Europeans are much more open. The South Americans as well. But I mean, it is a very sensitive topic. And how do you guys bring it up, and what are you seeing as that trend right now? Are you seeing a lot more people ask for it as far as?
I think it depends on the setting. The way I first got into it is when I first started offering hormone replacement. And so I would get the guys in wanting their testosterone and for energy and then we'd open that conversation. And a lot of the times, it would come up if they're on testosterone, they have ED, they have sexual dysfunction, and of course, testosterone, helps with those things as well. But it really opens up that door to have further conversation. And they see what you do. They're like, they know, oh yeah, you guys do a little Botox here and there. Like, what else do you do? So they are coming in and they are curious, like, what else can you do? And so I very welcomely open the doors and show them a whole new world. and then they're, a lot of them they have no clue that this is even available. I mean, they have no idea. And so just educating them on the possibilities and there's a lot. I mean, I hope we're going to get to talk about that, Jessie, later. All the things that we do to enhance male, and you do female genitalia. I mostly stick to the men, but I have done females in the past. But I think women are a little bit more comfortable with other women, and likewise, I think men are pretty comfortable with me.
Awesome.
So what are some of the complaints? Like, say if when men come in to your clinic, say, Jessie, what sometimes if they say, you know what, I just I want it to be a little longer. Okay, your mind would go to where? Like fillers, toxins. Where would your mind go if they're saying, I just want it to be a little bigger?
Well, it's all about confidence. I say confidence is sexy. And so if you're not confident about the appearance of your penis, let's say, we're going to say penis, right? We could say penis on this webinar.
Anything in it.
So if it's size, if you're looking for length, I actually like Botox a lot in the penis. So what Botox does, we're not treating wrinkles, we're treating the blood vessels, the smooth muscles and the blood vessels of the penis. And when you Botox that, it actually hangs longer and thicker at rest. And when you have an erection, it actually is fuller and stronger. And a lot of guys tell me they have more spontaneous erections. So we think the tissue is getting healthier because you have more oxygenation, more blood flow to the area. That's a very easy treatment. It's just a couple pokes and it's over, and it lasts for 4 to 6 months. It's going to give you length when you're flaccid and more size when you're erect. If you want more lengthening, then we get into more interventional things like we do the P shot with biologics, PRP, exosomes, things like that. It involves a pumping protocol. So we're stretching the suspensory ligaments of the penis, and they will get more length and girth over time. Fillers will give you length too, but they're more for girth building.
So when you do inject Botox, where do you inject
it? Lori's now like, oh.
I'm not going home and doing this on my husband, don't worry.
It's so easy to do. So we're in the corpus cavernosum. So that's the spongy tissue. That's all just blood vessels along the bilateral shaft of the penis. So that's what fills up with blood. We're just putting the needles right in there, 2 pokes, and you're done.
Wow.
Very easy.
Yeah, it's actually very easy. I have yet to try it, but I think it'd be fun.
You'll be the next model
too. So think of it, everything you do for the penis, you could do for the clitoris, because it's really the same type of tissue. And so we know that botulinum toxin will help with the erectile function of the clitoris / make it more engorged during sex, more sensitive.
Oh, so let's just take a step back. Like, what can you do in the areas, or what do you both of you guys do for male genitalia, female genitalia, just if you had a service list, just so people out there can understand what can we play with, or what are you guys playing with? What can be
done? Yeah.
So I have just basically SEO for male enhancement, and that drives most of my traffic right now is my SEO, because I don't do hormone replacement anymore. But so they come in, they know I'm doing some non-surgical procedure. I don't do surgery. So I do everything. I use fillers, dermal fillers. I prefer HAs. Sometimes I do fat transfer, and then sometimes I do Renuva. But basically, we're adding, you can add anywhere from 5 cc's, if 5 cc's, if you just want a really small one. I usually like to start with 10. So I have a special price point. Once they get to 10, the price becomes more attractive for them. And I usually tell people by the time, like if you want porn star status, like where your locker room and you can show it and you're King Kong in the locker room, you're looking at 30 to even 50 syringes. But that's spread over some time. It's not done in one setting, right? So, and then also, if you think about it, if you're just enlarging the shaft, the head's going to be dwarfed. I mean, if you don't augment that. So you usually, if you're going to add significant volume to the shaft, you have to add something to the glands. And as I've injected the glands, it's very similar to the lips. It's same mucosa. It's got lots of vascularity. I use the same products that I use for lips, the Juvenile Ultra or Restylane Kiss. It's very vascular. It's very pink. So when I'm injecting the glands and you aspirate, you always get flash. Actually, every single time you get flash. But it's okay. You're not actually injecting, intravascular. You just get flash because of where you are, and it's a highly vascular organ. Bruises the same as lips. It's pretty much the same as lips. It's just down there. So those are the different possibilities. And of course, like Jessie said, if you combine it with Botox, that's the easiest 100 units you can do. Like 2 pokes, 100 units by, like that's super easy, and like satisfaction is super high.
Wow, nice. What about you, Jessie?
So beyond fillers for the penis and for the labia majora for females, we do some biostimulation too. So with lasers and or fillers or even other things that make collagen that we inject to make the skin tighter, smoother, brighter, just more healthy, more youthful looking. And then we use lasers too. So we use special laser protocols for the penis actually. So we do with the lasers. It's photobiomodulation. We're turning on the stem cells and the blood vessels and the nerves to make the tissue healthier, to help with the sensitivity and erectile function. And for females, the same idea. We do laser the area to help with the tissue, even on the inside of the vagina too. That's vaginal rejuvenation to help with the lubrication, the pinkness of the tissue, the sensitivity. And then, so beyond shockwave therapy actually does work. So we think the sheer mechanical trauma to the tissues, micro trauma, turns on the stem cells for regeneration for the nerves and blood vessels. So both for men and women to the pelvic floor. We also do high intensity electromagnetic energy, MCELA, in America, it's like the M-Sculpt. It's a chair that you sit on that has this high energy that targets the pelvic floor muscles. There's contracting stronger than you could humanly do. Your Kegel exercises. We do know it helps with sex because you do use those muscles for orgasms, ejaculations, erections, females too. So it gives you the orgasm on the throne. So those are by machines, machines, injectables. We love hormones and peptides too because we know we need those to maintain our sexual function as you get older. As those go down, libido goes away. We get less blood flow to the tissue as the estrogen, the testosterone levels fall. So I like kind of a more comprehensive approach because it makes sense to me. It helps everything last longer too.
No, that's a lot actually.
Yeah.
That is actually a lot of stuff.
So tell me what type of lasers, like what wavelength or what type of lasers
Yes.
are you
So
using?
I have 2 different ones for the vagina. I have one is the long pulse. It's an ND. It's actually an erbium. So it's an erbium, but it has different pulse durations. So you're not like ablating it too much, like the old CO2 lasers had a lot more scar tissue and issues. And then my other one's a hybrid erbium and 1470. And so that has deeper tightening with 1470 and more superficial, fractional ablation for the mucosa. So that it's by Cyton. It's a 5-minute treatment. The other one's more like a 20 to 30-minute treatment. And we use other lasers for the external skin. If you're trying to smooth the actual labia, we have different lasers for that. We have, IPLs, we have our YAGs, we have a lot of different lasers for radio frequency even. For the penis, we're using a long pulsed ND YAG. So it's got a really cool setting where we're just pushing heat deeper down to target the blood vessels. And so we're creating new blood vessels, new nerves from that. And it works pretty well. And so, and for the anus, we're doing different types of lasers. Usually it's to help with the appearance and also the sensitivity of that sphincter muscle. But Jess, you could also Botox the anus too for easy penetration.
I was going to just ask you about Holtox.
Holtox. We call
Holtox.
it Botox, right? But men, women, you don't need that much because if you put too much, they're going to have fecal incontinence, but you want to make it easier for penetration.
Crazy. And
Lori's like being shocked.
I saw that on Instagram the other day, and I was like, okay, like last thing you want to do is like be incontinent.
A lot of patients coming in just to make it look prettier, actually, because they, I don't know if you look at your butt in the mirror, I don't, but apparently they don't like the wrinkles / the discolorations. We actually have a lot of men and women coming in just to make it look smoother.
Huh.
Yeah, I was going to say one of the most popular treatments we have at our office, I don't know why it got really popular during COVID, is intimate or anal lightening or anal bleaching.
Bleaching, yeah.
So during COVID, for some reason, I wasn't even paying for my SEO, but my anal bleaching was like first on Google searches. And we were just getting phone calls. Like people were just looking at their bum holes all day during COVID.
They were bored.
That's crazy.
We used like basically a chemical peel type of system. And we use a product by Promo Italia, the Pink Intimate. And then we use a permeability, an ionophoresis device to kind of permeate. It basically
Right.
pushes the product into the dermis, and it does lightening and also does rejuvenation. So it stimulates collagen, makes the vulva smoother and the skin tighter. And so just appearance wise, like Jesse said, it makes the appearance look better.
Wow.
Wow, it just kind of peels off that exterior pigment.
What's your typical range in age group that people are looking for these type of things? I mean, is there a particular sect of the population that is looking for it? I mean, you
It depends. I mean, Jesse, you probably do more dysfunction, so you may get some of the older gentlemen, maybe.
Yeah, I would say my younger, like I think 20, 30s to 50s, 60s, their appearance, and then I would say 50s and older getting more functional because that's when they really start to notice the issues. But you'll see appearance. I mean, I have older men in their 70s coming in for penis filler, and I have young guys in the late 20s coming in too. Females, it's usually more as they get older, but I definitely have women in their 30s, like they've had kids, labia change, look different after having kids, so they do come in for that.
So what does a consultation really look like? I mean, as far as just like how many syringes, what are potential adverse things that they need to watch out for, and what is maybe the lineup of where they may need to come in a month, 2 months later to keep enlarging it? Are there restrictions? Do they need to, I've heard people tell their clients they need a penis pump themselves throughout the rest of the, blah, blah, blah. There's just so many stories that you hear about what it is. What do you guys talk to your patients about? How do you counsel them? What do you talk to them about the aftercare and all of that stuff? Because it is a brand new thing, and you do hear, potentially fillers move, migration, all of these things are potentials.
So with my filler girth enhancement, yeah, when they come in, it's a great point. There's a lot of questions I do ask them. One, are you circumcised or not? When you're circumcised, you're a better candidate because when you're not circumcised, there's extra skin that the filler can go to, and it can create something called the accordion effect later on when the filler moves. And there's a dynamic of the penis when retracted or erect where the skin moves back and forth. So you've got to take that into consideration. Ask them about any Peyronie's disease, if they have any curvature, if they have any scar tissue, active infections, previous infections. Common question I ask, are they a grower or a shower? And so most people are growers, but I mean, I got one guy, he was like 10 and a half inches long, flaccid, and I put 20 syringes and it didn't do anything because there's
Wow.
so much real estate to cover. He also liked to not wear underwear so his thing could show under his pants. But anyway, so
Got a cool breeze.
so the consultation just involves setting expectations, the realistic expectations. And honestly, I mean, fillers, it's interesting, it's fun to do, it's high satisfaction, but it's not for everyone. I mean, you can think about the complications for face aesthetics, like necrosis, blindness. Well, the complications for down there, guess where the filler goes when you inject it into the vein? The inferior vena cava. What does that mean? That means a pulmonary embolus, death, right? So, there can be some severe side effects. There's never been like reported cases, but theoretically, and we talk about blindness and necrosis in the face, but down there it's pulmonary embolism, and that's life-threatening.
Interesting.
Wow. Are you finding what is the balance between homosexual, heterosexual patients that you're seeing in the male population? What's your take on that?
Are you
So
asking me?
Oh,
Both.
Both of you.
I'm in the Chicago suburbs. I would say I have more heterosexual men coming in than homosexual. I think with my homosexual guys, if it's too big, it's not comfortable for sex, the penis, if it's too big. It's more anal issues actually for my homosexuals. They want more anal rejuvenation. My females, I get all types of females coming in.
Yeah, probably more hetero, and a few homosexuals. Yeah.
Yeah.
That's very
Yeah.
interesting, right?
Yeah.
It is the dichotomy of it, and I think going back to what Jesse said is, when you feel confident, you feel sexy, and males, it is a trait of dominance and confidence when you have a larger
A larger organ. I would say
organ.
the homosexual guys, they tend to go more for the body contouring. They want the muscles. They want to look, youthful and buff and everything. So the penis is not as big of a priority for them, but it can be.
Interesting. That's very, very
Yeah.
interesting. So when you're developing your things, I know you guys use different types of fillers. Are there specific rheologies that you like? I know Jesse, I listened to your talk, and you do the biostimulators as well into it.
Ah.
Kind of go with maybe explain a little bit of why you choose different ones, or how that occurs in your head when you're looking at it.
So I've used all different fillers in the penis. I love fat too. Fat is a great filler for guys because usually most guys will have enough fat to steal, and we could take it from the mons pubis actually. So the penis will look longer if you take the fat on top of the penis. We're like getting the turtle out of the shell a little bit. But not all guys want to go through the trauma of a fat transfer. So sometimes the side. I know TJ likes Renuva, not a lot. I don't really use much Renuva down there. But I've used all different HAs. I even put PMMA down there. I don't love PMMA there because it's a different type of a feel, but some guys want it. I do a lot of HA and or the calcium hydroxylapatite. And I like the calcium hydroxylapatite because it's a little bit more of a firm filler and it is biostimulatory so that you do get the benefits for the collagen and the skin does look healthier. It does seem to last a little bit longer. But for HAs, I've used all different HAs. My current favorite is out of the Restylane family. I like Contour a lot. But I have other fillers from other companies I've been playing with.
Nice.
So I play around with all different kinds of fillers, and over my evolution, probably 3 or 4 years ago, I was really into Voluma. That was probably my go-to, and in terms of HA. And now, since Volux came out, I really love Volux. You know what it? I mean, I know you
Oh.
guys are big Allergan fans, but like the amount of pop when, like, it makes sense when it's FDA approved for the jawline, and you have to use as much to get that it's got a high G prime and the stiffness.
Does it swell a lot? Because I know injecting on the jawline, people complain with Volux. It literally like swells
I
on
mean,
the
you're going to get
aspect.
some hydrophilicity with any HA product, but usually it's well tolerated. I would say, and I keep track internationally too, what people are using. I think anecdotally, people overseas are liking PCL. Like there's
Oh,
PMMA, people like the
Elance.
consistency of that. The HAs, some people say could be soft, but the PCLs, what I've heard, and it's not here yet, not yet.
Elances, right? Are you talking about
Lance is
Elance?
what people overseas are really, or like patients are liking
Huh.
anecdotally.
I've heard that actually. I actually have a
Interesting.
patient. He's actually an MP, and he goes down to Mexico and gets it done, and he loves the Elance.
Interesting.
And
That
what is
lasts for a long time.
Yeah. What is your aftercare, or how do you? Because you hear about the potential migrations. I mean, you definitely don't want to have sex right away because there's a potential of moving these fillers and stuff like that. And you don't want a big block right at the base of the penis. Like, what are your guys' protocols afterwards, or what do you talk to patients about with regards to aftercare?
So I will say one thing. I have a guy near me who's using dimethicone oil in the penis, which is
What?
so illegal and so wrong. But I've had a couple patients come in who've had that injected, and it's all weird and messed up. And I'm like, you
Oh.
should report the doctor. I haven't reported him, but that's really bad. I've had patients from Miami who've had weird stuff injected in, like, from Brazil. I don't even know, some sort of oils, like
Ugh,
meth.
Silicone and
So,
silicone. Yeah.
yeah, like, and migration, like bad risk of that. But well, for aftercare, so I like to Botox them before if possible because it'll keep the penis more stretched out when they're flaccid. So there's not going to be as much movement because the penis is a moving target, right? It changes shape all throughout the day. But if they're not going to Botox, it's okay. I like to wrap it with a gentle compression bandage. They can still pee and take it off. It just keeps it a little bit more stretched out. And then I say, don't mess with the penis for at least a week. That means no sex, no masturbation. Most guys will listen to me for 4 days and they're going to do something with that. They want to show off their penis now. But it's good to leave it alone for the first few days. They're going to swell, they may have some bruising, but really they're just sore for a couple days. It's really not that bad. I don't really use antibiotics, it's really just leaving it alone, keeping it elevated. So I have them dress with maybe tighter underwear and keep the penis up because the gravity is going to want to pull the swelling towards the head if it's hanging down, which we
Yeah.
don't want. It might move the filler that way. I want it to go up so the swelling's going to go out of the base.
Okay.
Smart. That makes
Yeah, I
sense.
do like a light compression gauze. It's like a little small gauze wrap. We wrap it loosely. And you're right. I mean, I tell them 2 weeks no intercourse, but they're so excited after 4 or 5, I think 4 or 5 days, they just can't help themselves. Either they're going to use him or her, their friend, their new friend. They want to show off to their partner, or whatever it may be. But I tell them, please, like 5 days strict, please don't mess with it. And then after that, I think massaging is a very important part of the post care. because the product is in the certain space and it can move around. And so during that time when they're healing, it can move. When they have an erection, spontaneous erection, it can move. So they do need to do some massage, when it's comfortable to do so after about a week or so.
Okay.
What are some of the complications that you have either seen or you've read, in research or seen some of these things? What are some things that can happen?
Most common is going to be lumps and bumps and asymmetry. It's a moving target. Some people, they hang with their penis to the left or to the right. And when you put stuff in there, it kind of moves around a little sometimes. And so those are treatable. If it's a HA, sometimes I just dissolve or take away or add to. If I use the calcium, sometimes I will add to, or I'll even shockwave it to push nodule out of the way. Or you can flush it with water if you want. But the most common in the literature is going to be asymmetry and overfilling. There have been reports of necrosis, issues like that, but knock on wood, I haven't had that problem.
And we're using cannulas. I don't know about you, Jesse. I mean, most of the time I use a cannula. Every now and then I'll pop out a needle and do some fine detailed treatments with needles. But most of the time we are using cannulas. It is a filler, so any nodules can still happen. I've seen, I think, 1 or 2 cases of nodules, and you would treat that like any nodule anywhere in the face or body with a filler. And then my other thing that I did probably witness that was during a pee shot, a patient developed like a large hematoma, and the hematoma obstructed the blood flow, so they actually developed priapism. Luckily, being an ER doctor, I treated priapism in the emergency room, so I knew exactly what to do. I had him come in, popped an 18 gauge needle in the corpus, pulled out about 120 cc's of blood, venous blood, injected a little neosynephrine, and went down. But luckily, I was able to handle that. But I mean, that can happen if that ever would occur.
Well,
Interesting.
a lot of cool things.
Your ER background came in handy.
Absolutely.
So if anybody out there were to get in or want to get into injecting this area, what are your guys' recommendations as far as how to start? How to start, where to learn? I was talking to Jessie, I was like, you guys both should create a whole maybe didactic course here for the aesthetic immersion that we can help people understand how to actually start that process of injecting it. Because I don't think, these are things that you guys, how did you guys actually learn? Are there people that you followed, just reading books, so like all those things? Because it's a very narrowed window of a specific area in that aspect.
I think it's all, you want to know the anatomy no matter what. I started off doing fat transfer to the penis, like back in the day. I was doing fat transfer like 20 years ago in my fellowship and things like that. And so the penis, the labia, they're just other appendages that we have. And from fat transfer, I was like, well, fillers are a lot easier. So I just started doing fillers, and it's a lot faster and more comfortable for the patient. But I have a lot of hormones in my practice. So I think that brings in patients looking for sexual health. So I think that just kind of helps to build that part of the practice. I mean, we just do it. We talk about it. So as long as you know the anatomy and how to do the technique, I think it's very easy to do.
A couple things. How did I first learn? I think there was a nurse that I was at a conference with, and she did it. And we basically was sitting there on a paper napkin, and she just kind of drew it out for me. And then I went home and I was like, oh my God, I gotta learn how to do this, and started studying the anatomy and then reading books. And by the way, all the literature on this stuff, it's all from, like, most of it's from South Korea. If you look at all the literature PubMed searches, it's like it's all like South Korean doctors that are doing a lot of, and then maybe some from China. So reading books, literature, and then also in terms of marketing, it's tricky. It's not like the women are going to tell their spouses, hey, honey, you need to get this done. And it's hard to get a review. Guys aren't going to go on Yelp and leave a Google review about a penis augmentation, or even show their friends. You can't even get a word of mouth. Like, they're not going to tell their buddies about it. So it's kind of interesting. Like I said, the most that I do right now, most of my marketing is really just SEO focused, and getting some before and afters is hard too, because most guys don't want to publish their stuff online. Right. So getting them to consent to allow them to post, that's very challenging as well.
Right.
And then not getting shadow banned if you post it.
And on
You can
Instagram.
post it, but you don't block it out.
It's interesting with my females. I have quite a few who are very willing to have their before and afters, even videos of me doing the filler technique to the labia. I have quite a few females who have actually pathology down there, whether it be something called lichen sclerosis, which is like autoimmune, where the tissue thins. So they want to get the word out that this is a thing that's very treatable and even identifiable. A lot of women don't know what's going on in there. It's itching, it's burning, their skin changes color. So the women seem to be more open about it because for us, it's not, it's like appearance. Yeah, who cares? Like, it's a functional part. It's an organ that we use, like, to pee, well, or, whatever. So women are more open about it than men, I find.
Right.
Interesting.
And then a question that popped up, units of toxin that you're using to inject males or females in the genitalia area. Because actually, you have to break it down, right? There's actually the actual genitalia. For guys, there's scrotox. There's Holtox. There's
we brought in scrotox.
What? I know.
Yeah.
Do you guys do a lot of scrotox? Is that
Scrotox
common
for,
to
like
ask?
the wrinkly scrotum. I have guys who wanted to hang longer. They want to be more comfortable when they're riding a bike or doing a rowing machine, it seems like. We even Botox along, like for sweating, along the gluteal cleft, because a lot of guys don't like the way it sweats when they're working out. So you can Botox anything.
Yeah.
And then you
100
said
to 200 units for a scrotum, depending on how wide of an area. 100 to 200 units.
Depending on how much they want to hang and how wrinkly they want to be versus like very smooth versus like a little bit less crinkling.
Wow.
Yeah.
Okay.
Penises, they put a whole bottle in. Just do like 100 units. They're happy. The research shows between 4 to 6 months with 100 units.
4 to 6 months. Awesome. And then as far as fillers concerned, how do you start the process of talking to them that you're going to need more than just one or two?
Or do you have like outcome pricing? Like, the first session is going to be X amount of dollars, and the second one's going to be X amount of dollars rather than syringes. How do you talk to them?
I think I do it different than TJ. It's like if you're a grower versus a shower, if your baseline penis is already got a lot of surface area, you're going to need more filler to see a difference to have that wow. So I have some guys who are smaller. 2 syringes makes a difference. I have guys that put 10, 15, 20 cc's in. I don't put too much at once because I think that increases the risk of swelling and migration and asymmetry. The most I've done in one session is probably about 20 cc's, but most guys, I like 5 or 6 syringes is average.
Okay, 5 or 6 syringes.
What about you, TJ?
It depends. I usually like to start at 10. I just feel I won't do them. Like if they just want to come in for 2 syringes, I'll just save your money. Come to see me when you can at least do like 4 or 5, and then we can have a conversation. Because my fear is I'm going to do 1 or 2. They're not going to see anything, and they're not going to come back again. They're gone. Like okay, I spent $2,000 and I didn't see anything. So yeah, bye. I'm never going to do this.
And that's the same for faces.
Right.
You say save up and let me do something where you're going to at least see a difference, and then you'll appreciate how much you spent rather than not see a result. It's the same thing, right? Yeah.
Can you read those? I can't read that. I think it's too small.
Could you
Guys,
provide details
can you blow it up
regarding
a little
Botox
bit?
injections of the penis? I'm the one that can't read. Needle versus...
It's tiny. Sorry, guys.
Needle size, depth of injection, Botox dilution, etc.
Oh.
Details. They want details about injecting Botox in the penis.
You want to aim for the corpus cavernosum. So if you understand the penis, look at some anatomy, look at some cross sections. The corpus cavernosum is pretty big. You don't want to inject the urethra. You don't want to inject the vein or the artery. You don't have to go very deep. The corpus cavernosum fills up quite, you could do this with the penis. Your corpus is like right there, right? I use like a 30 gauge needle and just put it right in there.
2 o'clock, 10 o'clock, 3 o'clock, 9 o'clock, 30 gauge, half-inch, halfway.
Mm-hmm.
That's a good guideline.
Like in the middle of the shaft?
Yeah.
You're doing in the middle of the shaft.
Yes.
Okay. You inject them erect or flaccid?
Go ahead, Jess.
Well, so there's a couple of ways of doing it. It's published in literature. They take like a tourniquet and they wrap, they do it to the shaft and then they inject when it's like it's erect. I actually use a penis pump because it's more efficient for me than using a tourniquet. What do you do, TJ?
Like the tourniquet.
Okay.
Keep it on for like a minute or two and inject it. Keep the tourniquet on for a minute or two and let it go.
Yeah. A pump is just faster for me. I'm not a patient person. And if I'm doing filler, it gives me a sense of what their penis looks like when it's erect, because then I know if they're really a grower versus a shower and how much filler I really need to give it a wow difference.
So do you inject their fillers in erect or flaccid state?
Yeah,
Yeah,
that
so
would
I
be.
do it flaccid. I have another friend who does, we were just talking at the Toronto conference. He does it erect. So he actually injects primates.
Leonardo, yeah.
Yeah, do you do it erect or flaccid?
I do it flaccid, but I know Leonardo John does it erect, and I can see, advantages of doing it erect. Again,
Yes.
my experience with having that pre-epism case makes me a little hesitant to give them an erection and not
Yeah.
have them down later. I'm like, wow.
Yeah.
And
Right,
doesn't that
Yeah.
make the space actually less if they're erect? So
Yes.
then it's a lot. I mean, but if you're in the right tissue plane, and how large of a size of a cannula are you guys using?
22.
22?
I use a 22 by 70 usually, yeah.
22,
I like
70.
that.
And are you going
that's a-
distal to medial or distal to proximal or proximal to distal?
I've done all different ways. My current favorite is proximal to distal because the tissue at the distal end is very thin. What about you, TJ?
Proximal to distal, and then a couple of going reverse to both.
Thread lifting. Traditional
There goes TJ. He's going to be putting threads in.
I thought about
Down
it. I
under.
really
You've
thought
thought
about
about it? Oh my
Oh,
god.
wait, we know you've thought about it,
I've done
TJ.
threads for virginization. So you could actually thread, the vaginal canal to do that if you want. It's very complicated. I don't love doing it, but you could do threads there.
I'll leave that for the OBGYNs.
They're not doing it. It's sad. The OB-GYNs don't believe in vaginal rejuvenation. It's interesting. It's like they're not into sexual health as much for some reason.
It's true. They're just taught the medicine part when things break down. Let's see. Rhonda's asked, does medical malpractice cover this? I guess she's had her aesthetic practice insurance say that they won't cover P shots or genitalia shots. That's
Mine
odd.
does. So I guess you have to talk with your carrier and make sure they
you have to
understand
talk
what
with
you're
the carrier.
doing.
That
Talk to the
doesn't
carrier.
seem. It doesn't seem. I mean, it's another appendage, as Jessie puts it. It's just another organ. At the end of the day, if you can inject face, it's nothing different
But
as
they're
far as
really
injecting there.
they're very specific on what they don't want to cover you for. Like they'll some people some of them they don't want you to do threads, and you've got to have everything listed in your policy.
Different states so weird. Like in my New York practice, I have to have a separate malpractice insurance carrier for thread lifting, which is so weird. It's really
Yeah.
annoying.
Yeah.
Yeah.
Interesting.
It's expensive.
So know your state laws and talk to your malpractice carriers with regards to that is probably I would say.
Another question regarding Holtox. So how many units, say you're going to use like Botox, Xeomin, and Jeuveau, like the units that more people are familiar with. How many units do you use? Say, how deep do you go? What are the locations? Because there's two different depths of muscles there, and
Yeah.
you want to relax the external component. So kind of give us an idea of how that is done.
TJ, do you hold talks, TJ?
I don't hold talks, but it's interesting because I know that the botulinum toxin is FDA approved for anal fissures. And it was funny because one of my staff got a phone call and they thought it was being a prank, and someone was calling, "Hey, can you inject my butthole?" And then they just hung up on them, and they let it. Dr. Tsay, do we inject buttholes? I'm like, well, actually, it is indicated for anal fissures. And with that particular one, anal fissures, they're injecting the internal sphincter. So, but I don't do whole talks, but you guys, I'm assuming it's the external sphincter muscle that's.
It's easy
I
to
think
reach,
so.
and I don't really go. I never go more than 20 units, because I mean, you want to talk to the patient and see exactly what their complaint is. Is it more for just easier penetration? Are they just like really constipated? Like, what's the reason why they want the whole tox? And then 12, 15 units or so. You don't want to put too much at once because things might pop out.
Yeah.
Yeah.
And do you go all around?
You can. Sometimes
you
I don't want to poke too many times, so I'll just poke like, this is the, boom, 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 and see how it goes. And you can do more pokes if you want to, but it's a sensitive area. It is very ouchy.
Yeah.
Ouchie.
Oh yeah,
Okay.
yeah.
But we laser that area too, and the lasers they can be spicy. So we do topical numbing, we do laughing gas. My patients say sex is the best the 4 days after I laser their butthole.
Huh.
They're sensitive in a good way. I mean, they're happy, they love it. I have patients flying from outside the country for this, because not many
Wow.
people do anal rejuvenation non-surgical, so I am one of the few.
Yeah.
That's really cool.
Yeah.
A4.
And then charging for this type of stuff. I mean, do you guys put an upcharge just because it's a genitalia area, or do you charge it as you normally would for a face?
I think it's very fast to do penis, meaning, you're in there, there's always certain places you can put the filler, right? So I put usually like 6 syringes is my average. I think I'm charging like what, 5 or 6 thousand. It's not that much, but it doesn't really take much time. My Botox, I'm charging about 1,500 because it doesn't take much time either. If they do it along with a different penis treatment, like a P shot or something, I'll decrease the price because it's the same number of pokes really if I'm doing a different type of injection there.
Right.
What are you charging, TJ?
No, I agree. It's so fast. I mean, I could do 10 syringes in less than an hour, like 45 minutes of a Lux, And so I definitely give them a deal if they're doing 10 and above. And you have to include in there that, because I do a nerve block, I forgot to mention, I do a dorsal nerve block, right?
Ah.
So it's like a dental block, but down there. And so that takes a little bit of time, takes a little bit of time in preparation for that. So, but once they're blocked, then you can go to town, they feel zero. So you definitely want to factor that, but I don't charge them extra if they're gonna do 10 syringes, that's kind of included. But if you're gonna do any sort of blocks for Botox, but you probably don't need blocks for Botox, right? No.
Yeah.
So yeah.
Interesting.
Jesse, do you do a block for fillers?
For filler, I do. It's actually not that uncomfortable because my technique, I do some hydrodissection with some local anesthesia for my filler before I fill, so it's really not that bad. Most of my guys don't even need the laughing gas, but we do offer it just because it makes them happier.
Mm-hmm.
Yeah, and Botox is so easy there. Like I had a patient who was a dentist, and I told him about it. He was like, he went home and did it on himself by just reading. He read the paper. He loved it. He was happy. No numbing. I was like, oh my God. But guys are, when there's a will, there's a way.
I mean, that's honestly the truth when it comes to that.
Oh yeah.
Questions that they're getting is, do you guys offer trainings? Should they reach out to you? Can you guys offer trainings on?
Yes, I do I've had people who fly from outside of town. I do recommend they bring their own model though, so they could do the follow-ups and stuff. But if I do have some patients who are willing to be models for any of the penis procedures we do in my practice. So whether it would be lasers or shockwave or P-shots or Botox or anything, we train. Yeah.
Okay, and tell people your Instagram.
If you guys are setting up some sort of panel, that'd be an interesting thing to be a part of.
Yeah,
Do you train in your office, TJ?
I do not. I just haven't seen the demand, but I guess if people are asking, that's something that I could offer possibly.
Yeah, I've had people come and train with me. They've heard quotes for training from other people who do this like crazy amounts. Like someone was charging 130,000 to train. I was like, that's a lot. I know, weird, right? But
yeah.
Okay.
Yeah.
Wow. Okay.
Now you're gonna go learn it.
No,
and teach it.
I mean, and when you are injecting fillers, I think I remember you're injecting mostly along the sides.
Yeah, so injecting the head is actually a treatment for premature ejaculation. So I tell my guys, look, if you want the head to get bigger, yes, we can inject it. You might notice some difference in your sensitivity. I've done it, and some guys don't notice the difference. But if you want to get the head bigger, there's other options. So we know that the Botox will actually help the head look bigger too. I've seen that. We do the P shots where you have the stretching of the tissue and the tissue, so you actually get a size increase in the head size also. So if they really want the filler, I'll do it. I just tell them it might change your sensitivity for ejaculation. Have you noticed that, TJ, with your patients at all?
Yeah, that's a great point you mentioned, the premature, because that's a very well documented treatment, and they can look it up. I've had patients look it up and like, hey, by the way, this is a treatment. I've had people come to me for that too, because they knew I do fillers down there. So that's a great thing that I can just do, because even though they're not doing it for appearance, they're doing it for function. So that's actually interesting.
You can even Botox for premature ejaculation too. We do the issue of, you inject along the edges. Yes.
Interesting.
Lots of fun things you could do with Botox down there.
But to answer your question, Gideon, the particular plane, it's between what's called buccal fascia and dartos fascia. So if you study the anatomy, you get a cross section of the penis. There's the corpus cavernosum, there's the buccal fascia, and then there's a loose areolar, and then there's a dartos. So it's in between those two fascias that the filler is injected.
Okay.
It's a beautiful plane. Once you're in it, it's very easy.
Just glides, just like where the threads glide, right in that.
Okay. And then if people were to add on, how often will you do it? And once you get to where they're at, majority of people, what do you tell them as far as longevity or when they're going to need to come back in? Because, you know, they're going to use their part, and I'm sure movement, friction, all of that breaks down things a lot quicker in that aspect of it.
So it's like the more you use it, the faster you lose it, but you want to use it to show it off. And so, like my guys to come back in a year, year and a half, it's not all gone. You know, I have guys to come in maybe every 2 or 3 years for a top off. It might be if I use an HA, it might be 100% gone at that point. I have 2 different sets of guys. I have one bucket where they want to come in a couple times a year just to keep on getting bigger, bigger, bigger because they're obsessed. And I have some who are like, they just want to keep it, you know, kind of natural and maybe like every year and a half or 2 years. It's 2 different sets of guys. I don't know if you have that too, TJ. Some really want to go big, 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 and they just keep on coming in.
Yeah, I think that, I mean, I still quote them whatever we quote them for face longevity. So I give them the regular, you know, it lasts a year and a half to 2 years. But personally, I think it lasts much, much longer down there. I don't know that from what I've seen, I feel like the patients, you know, when I see them a couple years later, it's like it's still there, like it's still mostly there, and they just want more. It can be very addicting. I gotta warn you. I mean, it's a great, you know, it's a great thing, but it can be very addicting. I mean, it's similar to like the BBLs for women, right? They get a BBL, and then it's very common they get a second and then a third BBL, and you're like, how big can you go? But they just want to get bigger.
It's called PPD. It's penis perception drift.
There you go.
There's a term though called phallocentrism, where they're all obsessed about their phallus though, because
I have a couple patients like
that those are actually bad. They're not good candidates, but yeah. But
that's the BDD down under.
They're addicted.
They're addicted. Okay. And do you guys have a limit as far as how many you do at one session? Just for your guys' sake of comfortability? Is it 10, 20 syringes? And you're like, okay, we're going to stop here. And if you want, let it settle. And when would you bring them back? How long before you actually bring them back to continue adding on to that?
I mean, it's like most filler. I think it depends on the anatomy. If they have a bigger penis at baseline, I could put more in at once because I'm not as worried of it all scrunching back together. If they're a grower, I don't want to put as much in because that penis is going to move unless I Botox them too. I think the most I've done in one session is about 20. I say they can come back in 6 or 8 weeks if they want to, as long as it's not swollen, bruised, and sore. It's like the face. You can keep on putting filler in, but I don't want to go in too many times. I think that there's more trauma to the tissue. So I try to get them to as close as where they want to be in one session if it's doable.
Do you ever Botox them first, wait a couple weeks, and then have them come back?
Sometimes, yeah. I mean, I like the Botox because number one, it's actually functional too. It's going to help their erectile function, and they will hang longer and hang thicker, and it'll look bigger. And for some guys, that's enough. But some guys want the more wow, you know, big, big penis. But it does help to Botox them before because it doesn't move as much.
Yeah, I'm about 10 to 20 on the shaft, and I do cap out at 5 for the head. I just feel like because it's such a vascular area, every time I aspirate, there's blood, and it's like, okay, you just got to take it easy and be very careful down there. So I cap it at 5 for the glands.
All right.
And for the labia, you can put in as much as they need because some people, they have very deflated labia as they age. You can build
for the labia, Renuva. Have you guys tried Renuva for the labia?
I love that for the labia. Yeah,
like the best product for the labia. Yeah.
I do a lot of biostimulatory there too. I'll mix it with HA, like house, Radiesse with HA because they get that instant gratification. Plus that it's going to help the tissue quality over time, which I think is nice for females. So lots of things you can do.
Yeah, yeah. Now, on a female, that area can be really have a lot of bacteria and be an issue as far as infection. So what do you do after you treat
I make
them?
my entry point more, I guess, ventral, like the belly button surface, closer, higher up, basically. Because once you get towards the anus, you know, yes, it's not the nasolabial area, and I really haven't had issues there.
Good. Okay.
Very cool. All right.
Our eyes are open.
I mean, this has been I think it's very interesting. I don't know if I'll ever jump into it. I'm later in the game on that aspect of it. Leave it to you guys. But any last minute words for anybody out there that's interested in doing this type of stuff? Like, what do you recommend as far as jumping in, things that you guys have like, ooh, those are things that I should have learned a little bit ahead of time faux pas that you've done in the area that you're just like, okay, these are things you need to keep in mind?
I think the penis is challenging because it does change shape and size. So that's like the biggest thing you have to understand. It's not going to be a home run the first one time you do it. Go for an easy penis. Don't put too much in. Um, I mean, it's high patient satisfaction though. I mean, guys love it. Botox is easy too. So we're gonna start with that. That's the easiest thing to do.
Yeah.
Botox
easy.
is the easiest. Just be careful in the penis. Just set the expectations that there will be like a little irregularity is very normal, and it's dynamic, so it's going to move, and you have to just set that expectation. So if they're phallocentric and they're just expecting perfection, you just want to make sure that that's not what they're expecting.
Awesome. All right. Well, thank you so very much, guys.
So real quick, will you both let everybody know your Instagram handles or a way to contact you if they want some trainings or more information?
Yeah.
Okay.
Yeah. So mine is at Dr. Jessie Cheung. So at Dr. my name, JESSIECHEUNG. You can also just email through my website. There's an email you can fill out.
Perfect.
Yep.
And TJ?
Mine's at ageless_MD. Ageless_MD.
Okay, so we have that in the notes section, you guys. So if you want to contact them for more information or training, they're open for it. TJ is in California. Jessie's in Chicago.
Yeah. And hopefully we'll figure something out maybe next year on actually. I think it would be cool to do a module section on this that that you guys can watch and at least do some of the simpler things, and then do maybe a hands-on type of a thing later on. So we'll talk, guys.
Thank you so much for being with us.
Thank you so very much, guys. It was such a pleasure having you guys on.
Thank you. It's good to see you too.
I know. I'll see you guys in 2-3 weeks.
In 2 weeks.
Yes.
2 weeks.
All right.
All right.
Thank you guys.
Thank you so much.
Okay.
Bye, guys.
Thanks, you.
Have a good
Bye.
night.
Bye.